Okay, we're going to go ahead and get started. Good morning. I'm Barbara Lanning, co-president of the League of Women Voters of Orange County, and I am here along with my co-president, Sue Gilman. We want to welcome you to our February Hot Topics program entitled Black Health and Wellness, Disparities to Resilience. Before we begin, we'd like to start and invite all of you to join in reciting the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. At this point, I'd like to acknowledge any office holders that are joining us today and ask them to please identify themselves in the chat. We certainly appreciate the work that you do on our behalf. Now, let's go ahead and review a few of our Zoom housekeeping announcements. All the audience lines are muted. The webinar is being recorded, and the video will be posted on the League's YouTube website under playlist Hot Topics. It will be available for viewing within a few days. We are also streaming on Facebook Live, so that is another option to view today's program. The chat is open. If you'd like to send a message, just please pick all panelists and attendees, and you can post any questions for the panelists in the chat box. And as we said, the webinar is being recorded, and those chat messages to all attendees will be available for viewing. As you know, our Black History Hot Topics programs have always been one of the most anticipated of the year. This year is no exception as we discuss Black health and wellness. I would like to thank the local chapter of ASALH and our DEI committee, especially Virginia Meany, Marilyn Baldwin, and Sadi Ellis for their work in assembling this stellar program today. They have done such a great job that we plan to exceed our hour by about 15 minutes. So if you do need to drop off to get back to work, we will totally understand, and you will be able to view the last few minutes on the video. To start us off today, we are pleased to welcome back Elizabeth Thompson, who will discuss ASALH and provide a history of Black healthcare treatment in Central Florida, as well as paying tribute to revered Black medical professionals. Elizabeth is currently the Director of Community Engagement for the UCF Downtown Valencia College Downtown Campus. As part of her role there, she helps foster relationships with community leaders in Paramore and surrounding neighborhoods. She also plans community events for the downtown campus and coordinates the work of the Paramore Community Engagement Council, focused on improving the quality of life in Paramore with a focus on 5 key pillars: jobs, health, education, safety, and affordable housing. Elizabeth is a native of the Orlando area, and she previously served as executive director of the nonprofit organization, the Association to Preserve African American History and Tradition, Incorporated, also known as PAST. The cornerstone of PAST efforts lie in the operation of the Wells-Built Museum of African American History and Culture. The Wells-Built Museum celebrates the important contributions Americans have made to the Central Florida community. Elizabeth, the floor is yours.
Wonderful, thank you. And thanks everyone for joining. It is a wonderful Black History Month. As was said, I previously was the executive director for the Wells-Built Museum of African American History. And we always like to celebrate the contributions that African Americans have made nationally, as well as here locally, because of course everything starts local before it is national. And so if you'll indulge me, I will share with you a brief PowerPoint where we talk about the the Black History Month and so here locally, because of course everything starts the Black History. I'm getting feedback. Was everyone getting that? Okay.
We are not hearing feedback, Elizabeth.
Okay, sorry. I'm sorry. I was hearing a lot of feedback. Okay, so we want to talk about Black History Month. Obviously, we understand that February is Black History Month nationally, and we celebrate a theme per year. And so we'll talk about the origins of Black History Month. Here we go. Excuse me. It seems that my screen share is not working. Best laid plans, if you all will bear with me. Here we are. The Association for the Study of African American Life and History was founded in 1915 by Dr. Carter G. Woodson, and it is the mission of ASALH to promote, research, preserve, and interpret information about Black life and Black culture to the global community. So let's understand a little bit about Dr. Carter G. Woodson. He is known as the father of Black history. It was said that it was really his mission in life to promote and educate about history. There was a time when Black history was relegated to slavery, but we understand that African American culture and history is so much greater than that. And Dr. Carter G. Woodson took it very much as his life's mission to educate and promote Black history. He was the second African American man to earn a degree, a PhD, from Harvard University. And he established ASALH, or what would become ASALH, to create research opportunities, publication outlets for Black scholars. As a result of that work, he established Negro History Week in 1926. And it was chosen for a week in February that coincided with the birthdays of Frederick Douglass and Abraham Lincoln. And it was chosen for those two men because he believed that they were integral in advancing Black history and Black equity. And so eventually, Negro History Week would become Black History Month, and that would happen in 1976. And of course, we all understand that when we talk about Black history, there is so much, and it is so wide, and it is so vast that ASALH has chosen from very early on to select one theme per year so that we could direct the focus of Black history programming and information. And so the theme for 2022 is Black health and wellness. And you will find that in Black history celebrations throughout the country, a lot of those align with the national theme from ASALH. So you will see a lot of celebrations that call the attention to Black health and wellness this year. And this theme was chosen because it acknowledges the legacy of Black scholars and medical practitioners. And this, of course, includes medical practitioners that are top of mind, doctors and nurses, but it also includes birth workers, doulas, midwives, herbalists, And then, of course, a focus on mental health workers as well. And Black health and wellness was chosen purposely because it includes the many activities and rituals and initiatives that Black people have done and can do to be well and to take care of their health. So let's talk again from a national to a local. Let's talk a little bit about some of the historical medical providers here in Orlando. Now, certainly I was given a time limit. I'm not going to be able to acknowledge every Black medical healthcare worker in Orlando. So I will only talk about a few, but that is not to say that there was not a great impact made by a great many practitioners. But we will start by talking about the first Black physician in Orlando, and that would be Dr. J.B. Callahan. If you are in the area and you are familiar, you know that there is a Callahan neighborhood, a Callahan Center, and it is named for Dr. J.B. Callahan. He was here and he opened his own practice at the age of 25. And for a very long time, he was the only Black practitioner in Orlando. And this was at a time when white healthcare workers, white doctors did not have to see Black patients. And so in order to be seen, in order to take care of their physical health, they needed to seek out a Black practitioner. And again, for a while, Dr. J.B. Callahan was that gentleman. He was also the first Black physician to practice surgery at Orange General Hospital. That would go on to become Orlando Regional Medical Center. And that opened in 1918. And it opened actually with help from Dr. Callahan. He helped to raise some funds in order to help open that hospital. And of course, that hospital had separate accommodations for Black people, often lit by candlelight, often at a disadvantaged floor. And so but still able to see Black people in a hospital. The second Black physician to come to Orlando is Dr. William Monroe Wells, and he came to Orlando in 1917. For a period of time when Dr. Callahan went to serve soldiers in World War II, Dr. Wells was the only Black physician again in Orlando. And oftentimes he would provide free healthcare for Black citizens who could not afford their own health care. He was a very, very strong patient advocate and had a viewpoint of healthcare, not just taking care of the physical bodies of the Black community, but also taking care of their ability to have services and a place of belonging. And so in that vein, he built, owned, and operated the Wells Built Hotel on South Street. And it was the first hotel, and for a long time, the only hotel that would rent rooms and provide lodging to Black people here in Orlando. He also built, owned, and operated the South Street Casino, which was not for gambling, but instead was a community gathering place, an entertainment venue. So Dr. Wells not only cared for the physical being, and it is said that he delivered more than 5,000 children in Orlando, Black children in Orlando, but he also cared for the Black community as a whole. And so he was a community activist as well. And then we'll talk about Dr. I. Sylvester Hankins. And Dr. Hankins was a native of Orlando, just like myself. And he returned to Orlando after graduating from Howard Medical School. And he started his practice here in Orlando in 1926. And again, you have a gentleman who not just cared for the physical body and the health, physical health of the Black community, but also the community as a whole. And he was a very staunch advocate and spokesperson for the fair treatment of Black people here in Orlando. And in fact, he helped petition City Council to raise funds for land development and the construction of homes for Black people. And those homes that land development would become known as Washington Shores, which still exists today, and Murchison Terrace. And then we'll talk about a little bit what is now Guardian Care, but at the time, the Dr. P. Phillips Hospital for Colors. And again, before the introduction of this particular hospital in 1959, you had to understand that Black patients were, if they needed to be in a hospital, were a lot of times, again, on floors where the boiler room was, or you had women giving birth in the same area as tuberculosis patients, because they were relegated to a certain area of the hospitals that would allow, and not every hospital would allow, but those hospitals that did, for doctors to see Black patients. So in 1959, the Dr. P. Phillips Hospital for Colors was established, and the sole purpose was to be able to provide dignified care, and at the time, equitable care for Black people. And that building is today the Guardian Care Nursing and Rehabilitation Center. So there has always been a long history of disparity as it pertains to treatment, both physical, medical, and community of Black people. And a lot of times, one of the running threads that you will see is that early on, medical doctors were not just relegated to medical care. A lot of times the care that they exhibited stretched and reached out to the community, and reached out to advocacy, and reached out to activism, because one area of care is not holistic, it is not complete. In the beginning, when they were reading my bio and they were talking about the operation of the Paramore Community Engagement Council, and they talked about 5 different pillars: jobs, housing, healthcare. You have to understand that in order for a community to be holistically healthy, you have to address it from several different areas. Because of course, if I have a job but no place to live, I am not in the most healthy situation. Or if I have health care, but I can't afford to provide education for my kids or what have you, then I am not in the most healthy situation. So we understand that these things often work in tandem. And that is why we are very, very glad to welcome our panel, because we will have a lot of representation from many different areas of healthcare. And so before we go into our panel, I want to take this opportunity to introduce our moderator, Renata Sego. And she is an award-winning journalist that has, throughout her career, documented the wealth gap, the global influence of Black Harlem Renaissance era dancers, and grassroots movement to re-enfranchise youth and adults here in the United States. Prior to her career as a professional journalist, Renata worked in Paris with newly arrived immigrants from North and West Africa. And as I'm a native of Florida, she is a native of Chicago. So please, if we could welcome our moderator, Renata Sego.
Thank you so much, Elizabeth Thompson. That was such a phenomenal presentation, really, really eye-opening. And so at this time, we're going to create a space for some conversation about the current state of health for Black people in the United States. We are now 2 years plus into a pandemic that's exposed years of inequities across many facets of our society, especially in the healthcare system. I mean, it's apparent from how health assessments are designed, to the availability of coverage, to the very images that medical students see in textbooks. Some of what we have prepared and what we'll discuss for the next hour or so will surely have resonance in other parts of the world. And it's my sincere hope that this conversation brings some new perspectives and maybe even some healing. We're very fortunate to have a group of distinguished panelists who spend much of their time with people in need, probably around this time in particular. They might be busy, so it's a gift to have them here with us. We'll start the conversation with introductions. Can each of you tell us about yourself and what main challenge you've experienced as a care provider? And we'll start with Dr. Candace.
Good afternoon. It's such an honor to be here again with the League of Women Voters on a panel. And so I really appreciate you bringing me back. I think this is a wonderful panel celebrating Black History Month and looking at Black health and wellness. So I'm looking forward to the conversation as well. Thank you, Renata. And thank you, Elizabeth, for that wonderful presentation. I took notes. I didn't know some of those things as I'm not a Florida native. So great stuff that I can tell my son about today. So I'm Dr. Candace Jones. I am a pediatrician here in Orlando, Florida, at Edgewater Pediatrics. And I provide care to children and families, I'd like to say, from birth until young adulthood, and also work with their parents because family, the adults in the family, it affects the health of the child. And so I do my best to be the auntie and get in there and be a part of the family to help guide parents and make sure that children are healthy and they stay healthy. And if we have any problems, that we addressed it in a holistic way. And so again, I'm looking forward to our discussion. Thank you.
All right, thank you so much, Dr. Candace. And now to Dr. Sankey. You're on mute presently, Dr. Sankey, so we'll take a few moments. Okay.
Thank you so much for the League of Women Voters for having me here today. We do know that optimum health is the birthright of every American. We know that, but we also know that there are health disparities. So my name is Dr. Jennifer Sankey, and I'm a performance psychologist and a registered nurse. Today, I'm actually representing the Central Florida Black Nurses Association of Orlando. And our mission really is to advocate and to provide solutions and even strategies to ensure that every American have the highest quality of care, have access to care. And so one of the things that I'm really interested in talking about is not only the community, but our healthcare workers who are on the front line every single day, our nurses and our doctors, anyone who enters into the healthcare environment. Also, we want them to be healthy because they're caring for our mother and our father, our sister and our brothers. And so today, as we go through the conversation, you'll hear me talk more about how healthcare workers need to be healthy, because when we feel well, we function well. And we can provide the best level of care for those around us. So thank you for here. I'm excited about the conversation.
Thank you so much, Dr. Sankey. We're thankful to have you here. And now for our next panelist, Ms. Mary Jo Horde.
Good afternoon, everybody. I'm Mary Jo Horde. I'm a licensed clinical social worker. I've been working in the community for 49 years. And most of that time I have worked with children, adolescents, adults, couples and families providing mental health services. I can't think of anything that is more important than seeing about our mental health. And this pandemic that we've all gone through has absolutely positively made us more aware of what's going on with our mental health. These last 2 years have seen our agency, I'm a clinical social worker for Lutheran Counseling Services. We have probably tripled the number of clients that typically would come for services. And I think we've figured out that we all have had some sort of issues, but how we manage them, of course, is the problem. And I guess from my perspective, I'm just very happy to say that many people have done pretty well during the pandemic. It has certainly brought to light disparities among health care for Blacks. And I do want to thank the League of Women Voters for this forward-thinking program as we honor Black History Month. And I also am very happy to get involved in the conversation, especially about psychiatry and mental health, psychology, and counseling.
Thank you, Miss Mary Jo. So let's start with the first question. COVID-19 has exposed some historic and systemic disparities in communities of color. What challenges have you experienced as providers? Let's start with you, Mary Jo.
Typically, since my area is mental health, most of the time we have to help people afford services. So I would say the biggest challenge has been affordability. The second challenge has been accessibility, making sure people can get the services. And so there have been some movements in mental health and health to take services to people in their homes or wherever they are, serving the homeless on the streets, taking services to them. And of course, that has absolutely helped the way that people can access services, can get the care that they need. So those two things have been really important.
Okay, and you deal with mental health. We've got some doctors here who also deal with people who are experiencing that physical ailments. Let's start with Dr. Candace. What have you seen? What challenges have you seen within the past 2 years that have really been present in your world?
That's a great question. And I echo what was just said. As far as mental health, we know that our children were prior to the pandemic, we were seeing a mental health crisis brewing. And since the pandemic, it has exploded. So we are definitely in mental health crisis with children. I've seen more and more children be Baker acted and admitted for mental health breaks, as we would say, suicidal attempts and ideation, depression, anxiety. The pandemic, I think, exposed that when initially kids were kind of staying at home, were sheltered in place and schools were closed. And school was a safe place. And I understand why that happened, to keep kids safe from getting COVID, because it was new and we didn't know about it. And so we're dealing with the fallout from that. Many of those children did not get the care that they need. And as was mentioned, quality is a problem, and access. There are long wait lists. And with my predominant Medicaid population, not a lot of access for me to have places for those children to go without having long waits. So as a pediatrician, we are having to pivot and be mental health providers and seeing kids weekly, checking in on them, even starting medications that I normally would not have done, consulting with doctors on the phone, and just waiting it out until they can get in. And so this is the emergency that I'm experiencing. And the other one would be vaccine hesitancy, because we know children are eligible now to get the vaccine, and just working with parents to increase the uptake of the vaccine in the children, in the child population, has been another big challenge for me in pediatrics.
Wow, and those are some serious challenges here, and we'll get to how you all are taking care of yourselves as individuals in a moment. But Dr. Sankey, what have you been seeing in terms of challenges?
So, mainly in the nursing workforce, what we're seeing is that nurses do not ask for help. Medical professions will go to work unwell, and that's what we call it, unwell, because they feel like they have to go and support their team. And so they're going to be there no matter what. They're going to show up with the sniffles, the coughs, and they're going to show up because they want to be there. And then the long hours, the critical nature of the patients have changed significantly with COVID. They see a patient well one moment, and within 15 to 20 minutes, their condition is changed. And they're seeing more patients dying than they've seen before. Also, one of the challenges is changes in processes. Do I have enough PPE? Do I have my gloves, my gowns, the mask? Do I have everything that I need so that I can stay well. And so that's very stressful for our nurses. I mean, some of our nurses have actually gotten COVID themselves and been at home very sick. And so sometimes those are the things that I think we've seen in nursing, is that, you know, we want to care for people, but we need to also care for ourselves.
Mhm.
What does that look like to you, Dr. Sankey? I mean, you're president-elect of a whole association full of nurses. What does self-care look like?
Well, self-care is really it's really twofold. It's really about the individual recognizing what they need. What are their needs? What do they need to do for themselves? And then it's the environmental things as well. What in the healthcare setting or the work setting do I need? What support do I need? What resources do I need? So it could be as simple as scheduling time for yourself to take time off, even if you're not going for a vacation or going for a doctor's appointment, that you have just pre-scheduled yourself time off proactively so that you can actually just say, I'm off, and 2 weeks from now, I'm off. And so I know that many nurses work 12-hour shifts, but again, it's also good to build in that time off for yourself. And every day, check in with yourself. How am I feeling? What's going well? What's on my mind? And, so those are ways that we can self-care, even just journaling. What went well? Many times we see things that didn't go well, but what was that one thing that went really well today? Who was that one patient that said thank you? And so when we make a difference, I think we have to really celebrate that, and that can help us stay balanced.
Yeah, that's awesome. Dr. Candace, what about you? My goodness, prescribing medications that you usually wouldn't. How are you taking care of yourself?
Yes, I do multiple things, as Dr. Sankey said. You have to hit it from all different directions. But probably 6 months ago, I did start therapy. And so if I can plug one thing today, it would be that, I'm hearing this theme of everybody needs a therapist. And I really believe that now. And doesn't have to be after a tragedy or something bad happened. I think it's just another layer of support system that we can have to just help us with our day-to-day interactions and things that we do. And so that's been helpful for me, and not so much with work, because I've always been able to kind of, and I know this may not sound good, but kind of disassociate. Work is work. I care for my patients and my families. I take off that hat and I come home. But I started realizing that some of that was coming home with me, being tired, worrying about the pandemic and my kids and other kids, and the whole political, there's a whole lot of stuff in society going on that's stressful. And I just started feeling that weight. And so I said, you know what, I'm going to talk to someone to tease all of this out, put it where it belongs so it's not on me, and being able to manage those emotions that I was feeling. And so it's been very, very, very helpful. So that's my one thing. Exercise also, I love my Peloton bike. We have a dog, and she's fairly new. She's been with us for about a year. So we did that from the pandemic. She keeps me busy and outside and walking. So that's been good. My daughter and I, we try to do some yoga, and I'm still practicing trying to do more meditation. So absolutely. And when we can get away, we love taking trips and traveling as a family. So all of those things.
That is really, really interesting. And you have also a podcast, and we could hear a lot of your experiences through that form of expression. Now, Dr. Candace, you're seeing a therapist. Mary Jo, you mentor therapists. You are a therapist. What are you
I am a
doing for your self-care?
Yes, I am a therapist. Boy, these ladies, Dr. Sankey and Dr. Candace, you guys are right on with all of the different types of behaviors and attitudes that we can make Dr. Candace the poster child for getting mental health. I like that a lot. So everything that the ladies have said is just absolutely correct. You have to be able to understand there are different layers to self-care. And I do agree with Dr. Candace that we do our work, we're professionals, but that we all have other sides. And so we are trained to do our work, pretty much leave it at work, and then we have other things that we do. So in my work, I'm used to really prescribing or helping people to understand, let's look at 5 different things that you could do for self-care. So I'm used to having them, come up with 5 different things, whether it's exercising, it's better nutrition, learning to get some sleep, doing something different than work, having some hobbies. That's why traveling is important, reading. I'm very active with my sorority. And so there's always something going on where I can get into what's happening in the community and not have to deal with what I'm working with my particular client. So I'm an advocate for work balance, trying to do what you need to do for your professional life, but also we have a life and we have to nurture that life outside of work. We have to understand that that's just as important as what we do, because we have to be well-rounded.
Thank you so much. So we actually have a question in the audience. I was just chuckling to myself earlier when we had some feedback. This person is a registered dietitian dealing in food health and nutrition. The question is regarding this pandemic, and the potential of perhaps future situations beyond our control. There have been a lot of studies related to vitamins and supplements and what we take into our system. This is just a rough generalization of the question, but what role is food playing in your own relationships with your self-care, and also how you support your patients? And we could start with Mary Jo.
Well, I do believe we have to be intentional about eating healthy. I'm not the best person to talk about that, but I know that we should eat healthy. And I think we have to really work on using our brains and what goes on in our family to plan the best meals that we can to get what we need. And we understand about, the food deserts that we have in our community, but we do have to work hard at coming up with making sure that we all are taking the right vitamins and supplements and not eating a lot of junk food. And so if that means we have to spend more time in the kitchen cooking, okay, let's make that an activity for the family. So I would like to see more families get involved in how they eat healthily.
Okay, what about you, Dr. Sankey?
So I certainly agree with Mary Jo. Meal planning is critical, because we all know that when we're stressed, if we have not planned that meal, we're going to eat those things that probably are not the most healthy. We also do know that sugar and stress do not match. The more sugar we eat, the more stressed we become, because we don't have the fuel that the body needs to balance it. So certainly, absolutely, food, knowing the food groups and getting a variety of fruits and vegetables and nuts and grains, all of those are very critical to our health and our well-being mentally and physically. I would even add spiritually. And so I think that we have to really begin to plan our meals, be very intentional about if we're getting enough of the fruits and vegetables that will give us the vitamins that we need. Supplements, they have their place, but I certainly think that if we really get the fruits and vegetables that we need, and even just basic sunlight, that gives you vitamin D. I do know that we have darker skin, but there's ways to still get sunlight that can help with boosting our vitamin D and to kind of strengthen our immune system. So there's many ways to do that, but I think it's just a matter of being intentional about what we eat. And I would say many of the diseases that we see in the Black community, diabetes, hypertension, and high cholesterol, they're lifestyle and diet related. Mm-hmm. It's because of what we're eating, and it's what we're not doing. So we're not exercising and not eating the right thing. Those are really the contributing factors to why we have some of those conditions.
Okay, Dr. Candace, you work with kids, and we're talking about food and things we put in our body. Vaccines are also something that we have a relationship with, right? So I want to kind of also shift the conversation to that as well. What you've noticed about the availability of vaccines or awareness of vaccines in general.
Yes, so this is a big issue right now. Since vaccines were made available, initially not for children, and then finally children came in. Children make up, I think, around 25-30% of our population, right? And so they make up a big part of our community that that contributes to us reducing the spread of this virus, right? And so it makes sense that they would be a part of our vaccine efforts. And children get vaccines, and families know about vaccines because most children get vaccinated. The overwhelming majority do. And so it's surprising as a pediatrician that so many families have chosen in all communities, the Black community for different reasons versus certain populations of the white community for different reasons, are declining vaccination. And some are hesitant and some are just outright not going to get it. And so my goal is to reach those that are hesitant, who have questions, who need more clarity and more knowledge and education around the vaccines, to know that they're safe and that their child is going to be safe when they get the vaccine. And so I've done, all pediatricians, we're working really hard to try to understand the underlying cause of this hesitancy and address those things. So I ultimately just ask everyone, just like we do your vital signs now, I ask, have you gotten the vaccine? And if you've had COVID, because there are long-term effects of that. And then from there, I ask, well, if not, what are your concerns? I'm your trusted pediatrician. Let me help you make this decision. And so we have a conversation, and that's very important.
This is interesting because the vaccines have been free, and so, but there's this history, there's a relationship that the Black community has had with vaccinations, in the past, and that's a whole conversation. But I want to sort of ask, what resources for preventive care, like before we get to a pandemic, what resources exist for people who can't afford the traditional route to get help? Do you all have some things in mind on the mental health and physical health front?
Well, I could start off by saying in the Black community, and I guess other communities as well, there's a lot of misinformation. And we need to do a lot of education about things that are healthy for us. So I think the best way that we can do a lot of preventative care is get the word out to people in a way that they will hear it and understand it. And I think all over the country, people are doing a lot of wonderful things. Like, I think having a bus and outfitting it for whatever it is, whether it's for mammograms or it's for handing out food to children at schools, that takes what is needed to the people. And I feel like once we get education, once we can make it so that everybody has access to what they need the way they need it, that is really going to go a long way for preventative health care.
So you're saying information, get the word out and get the right word out.
Yes.
What about you, Dr. Sankey? What have you observed? Are there sort of concrete spaces or places that you could suggest for people who don't have access to healthcare coverage, but really want to take some steps to get, better or make sure that they don't get worse?
I think it's really about informing them where the resources are. We have many community health clinics, either low or no costs for them, but they may not have transportation. So sometimes it's not only they may know, but they now need the resources to get there. So it's really a combination of things. Not only do they need the information, but oftentimes it's all about relationships. So people will go to the doctor if they think you really, really care about them, even if they were hesitant in the past. So sometimes those relationships and educating them, but the churches are a place to start. Some of the underserved communities where people wish someone would come and provide them with the resources. I like the idea that Mary Jo said about the bus. I mean, that means that you're going into where the need is. You're not expecting them to get to the building, you're taking it to them in the community. So I think we just have to do better about saying what is free, what is available, how can I help you to get, Medicaid, or how can I help you to get those things? They may not have the support systems. And so sometimes we need to identify that in our communities, and we can start out by just really being like footmen or foot soldiers out there, identifying those individuals and then helping them, connecting them to those resources.
What about you, Dr. Candace? And you know, after that, I want to shift to actual policies that we can maybe pay attention to in the coming months, because this is where solutions may be taking place potentially.
Right. I agree with both of the ladies in some of those elements. There's a layered approach to achieving the equity, health equity that we're looking for the Black community. And it's not always the individual's responsibility. Even when a few minutes ago, we were talking about nutrition, it's not always the individual's responsibility. That's only a small portion of health outcomes. And so there is a societal responsibility. And as we set up systems and policies at hospitals and clinics and in communities, we have to have an equity lens that divvies out services in a way that, like Mary Jo said, that will reach that community. So having trusted messengers from that community will probably improve uptake of those programs and utilization by the community members. Having programs situated where they're needed may improve uptake, but first you need to know where they're needed. That's data and research.
Mhm.
And so it's so many layers to this, and it starts with having a goal or putting equity out front, wherever we're going to give everybody an opportunity to have health. And we see that the Black community is struggling, and these disparities are rampant in their community. Let's find out why. Let's utilize the trusted messengers. Let's put in programs that they'll uptake. But first, we got to have people that look like them at the table and making sure we're heading this in the right direction. So we got to be at the table when these things are being set up to make sure they're going to work in our community. So there's so many layers.
What are your thoughts, Mary, on this policy thing? I mean, because when we're thinking about mental health, there are so many instances in which people may feel silenced or be silenced, or may not have the tools, the traditional tools to communicate their needs. What is your advice for people who may be in situations with relatives with disabilities, for example, on how to advocate?
Well, your topic is extremely important because everybody doesn't have, again, we're back to the information or the education as to where to go. And I just want to take this in just a tiny bit of a different direction. As a social worker, trained social worker, my job is to pay attention to the whole family, to the needs of everybody in the family. And so I can't just take my one client and look at him or her in a vacuum. I have to understand their family situation, their community situation, and the things that matter to them. And so once the trained professional can do that, then we have a better handle on what the family might need and where to point them. And I do have to say, Central Florida doesn't necessarily have a whole bunch of resources, but generally, if we can get to a trained professional, they can make some sort of suggestions. And I do like what Dr. Candace said about, everything to me kind of starts with the pediatrician or the medical professional. They get the first dibs on, well, what's going on and where can we send somebody? And then if we can get to the right professional, that's where things will start happening. And so to me, it all boils down to education and correct information, or at least someone being able to make a correct referral. So I think anything kind of starts from there.
Thank you so much for that. Dr. Candace, you work with children. There are so many situations where children may be having experiences and don't necessarily know how to advocate for themselves or express what's taking place. What insight can you bring to the conversation about, potential ways to support children or solutions on that front?
Absolutely. That's why, and I believe in pediatrics, with any healthcare provider in pediatrics, we need to provide evidence-based care. We need to provide comprehensive care. And so some of the elements we have in our practice will address or bring out some of those things that children don't know to say. And so screening for food insecurity, if they live in a food desert, screening for if they're having trouble meeting their bills, so that I know, do I need to connect them with resources, social services or resources for those issues. Also screening for things like depression. Many parents don't know their child is depressed or thinking about suicide. You know, so many things we do are screening for trauma, right? And addressing those issues. And that guides what I do, but also talking to young people, especially our preteen and teenagers privately, so that they can feel like they have a trusted person to share with what's going on in their life. And so a lot of part of my time with my families and my patients is telling them what to do if they're struggling with school and the family's having trouble at school, giving them advice and guidance on how to navigate the school system, right? And ask for this or that service at the school. And so that's a huge part of my job with helping family, advocating for families and helping them advocate for themselves. But I say, you know, when something's wrong and just yell help, ask for help, and there will be someone there to guide you. Just find a trusted person.
Thank you. Dr. Sankey, did you have a thought as well that you wanted to add?
Yeah, I think, she mentioned about policies and health screenings. I would just kind of expand on that a little bit. Health screenings, even for adults, for colon cancer, for breast cancer, those are things that, our government has put funds in place for us to be able to have those done. But still people are not getting screening. And oftentimes if you get a screening and we identify something early, the outcome can be so much better. But many times we wait till we feel the pain until we can't move or whatever. And at that point, many times the body has already advanced to various stages. So I would say that as, males, prostate cancer, some of those things, I'm not gonna say they're preventable, but if you detect them early, the outcome can be better. So that's getting that PSA screening when you go to the doctor, even the rectal exam that people don't like, but it's all a matter of assessing the body. And again, many times males in general, they don't like to go to the doctor. So us nurses or our wives or sisters or mothers, we need to be the advocate and ask them, you're 50 now, have you had that colonoscopy, or for women, just teaching them simple, it's okay to do those self-exams every month. It's okay to have a mammogram. So those are the things I think that we can do in the Black community with educating people. Don't wait till you feel the pain. Don't wait till you see the sore. Don't wait until all those things happen, because now the body has gone through a progressive stage of the disease, and it may be difficult to bring it back to that normal state.
Wow. Really, really important points. And it's something that just was, you all have brought up, was just being in pain and not even being aware, being in pain and it really getting to the last minute for you to really say, woo. So we're getting some questions in the chat box, and I want to ask you all if you may have an answer to them. One person is asking about immunity. Is there any immunity from having had COVID? And if so, how long does it last?
I think I can take this one. Yes, there is immunity. We have some new information, new research that I was just looking at about 2 weeks ago. And I want to make sure I say this carefully because I can see where it can cause problems. But there was some information that came out from the CDC showing that COVID infection immunity, so immunity after COVID infection, is very powerful. And immunity, specific immunity after vaccination also is very powerful. So they're trying to study which one lasts longer, when they start waning. And as we know, everybody's body can be a little bit different. But what we know is the best case scenario to have the most robust immunity is to get all of your doses of the vaccine and have your booster. For those individuals who've had a COVID infection and they get their vaccines and are boosted, they have superior immunity if in comparison to the three. And so that doesn't mean go out and get COVID, because you don't know your outcome. Is unpredictable. You don't know if you'll do well, have mild disease, asymptomatic disease, or end up in the hospital and die. So we don't want to do that. But just know there is some synergy, I would say, in having COVID infection and getting your vaccine series and boosting to have the best immunity possible. Hope that answered your question. And I think it's depending on how long it lasts. It's different for individuals, but we know now we're saying every 6 months a booster that we've done, and they may be going down on that. So I think the research is ongoing, trying to tease out what's the best interval and then how long natural immunity lasts. And, you know, last year it was 3 months and go ahead and get your vaccine. And I think it's just, you know, this is a new situation and the research is ongoing. And I think a lot of people complain about it's always changing. Something's always changing. Well, kind of like, duh, it's going to change because we're always doing research. We're always finding out new things. And you have to remember, these are different variants that act very differently than the one before. So then you have to research that. So we're behind this thing. It's ahead and we're learning on the fly. So things will change.
Yeah, thank you for that. And when you began your response, you said you wanted to be careful about the words that you used, language. And it made me think about a recent conversation, different group of panelists, but similar topic about medical care, healthcare. And one of the panelists, who's a doctor, he brought up patients being able to say, communicate, I don't understand what a doctor is saying, you know, or just being able to say, look, could you break things down for me in a different way? And, you know, that's something that really resonated. We're going to be running out of time soon. Oh my goodness, so many interesting points here. I'd like to invite people who are watching to submit questions, because we want to make sure that while we have the valuable time of our panelists, that we can answer some of the questions and concerns that you may have. In the meantime, I want to ask you all a question about basically if there's one single sort of silver lining that these 2+ years of being in this pandemic has brought us, what would you say it is? You know, there's so many conversations about the challenges, but what breakthroughs have come from these moments, you think?
Well, if you don't mind, I'd like to start because I want to really and truly make this point. The accessibility of employee assistance programs where people can get mental health treatment free for 3, 5, 7 sessions has just been absolutely a game changer for people of color. And without those services, I don't think we would be seeing the numbers of people of color that we're seeing in our agencies, because they just don't have the money. So if we could push legislation, policies, whatever, so that these services are available to more people, I think that absolutely is a game changer.
Okay, so you're seeing more people who are using these services, in other words.
Definitely. That has brought them to counseling. It has helped them to see what goes on, whereas they would never probably have walked into an office in their lives. But now someone said, hey, we have this service, it won't cost you a thing, they're willing to come. Thankfully.
Yeah, what does continuity of care look like after those 3, 5, or 7 sessions? Are you seeing people in a position to continue?
Well, sometimes people do need more services, but actually EAP services are designed to just figure out what's going on and make a referral to wherever the person needs. And so it's not treatment per se. Sometimes people think it is, but it's not. We want to get them to where they need. Then people typically use their insurance benefits where they pay a copay to continue services. And a lot of people do because they see that it's valuable. So they keep on coming.
Okay, someone in the chat is saying, spending more time at home, enjoying our home versus travel and enjoying the daily relationship with family members. What about you, Dr. Sankey? What would you say has been a breakthrough?
I actually was going to say spending time at home with family and with friends. Which I thought was going to be mine. So when you said it, I'm like, oh, let me think of another one. But you know, that was mine. It really was, because I mean, spending more time seeing them more, especially in the health profession where you just go all the time. You're on the move. It has really seen the value of family, the value of affirming individuals, because we've seen people lose their life in just a short minute. So the value of quality time, making meaningful memories, not just saying hi and keep on moving, but really connecting with people in a more meaningful way, whether it's on the phone, because again, if you couldn't see them in person, still you can pick up the phone and call them, FaceTime them, text them. All of those, I think for me, were silver linings. I mean, I would even say for healthcare workers, I mean, I'm out of the direct healthcare setting, but I've heard more about the way the healthcare organization is supporting their workers within the healthcare environment, because I have family members who work in the healthcare environment, 5 of them, as a matter of fact, and they just talk about how the organization has come together with more resources available for them. So those would be my 2 things.
Thank you so much. Dr. Candace, you shared earlier a few things. Did you have any more to add?
Thank you for ending on a positive note. It's really good. We've had a lot of positives, right? But I love that. I think creativity, I think we've had to be creative as a society to get around everything that this pandemic has thrown at us, and all the things that the other lady said are being creative. And in healthcare particular, you know, telemedicine booming, where we can see patients through the screen and try to still see them. My therapist is telemedicine. She's not even in Central Florida. And that's something I was looking for. So just getting creative to meet the demands of what this pandemic has caused is something that I really appreciate. And that's in our personal lives, but also in the medical world as well. And one other thing I really appreciate, you know, the health disparities that the Black community experiences are differences that should not be. And they're not always due to personal responsibility. There's societal responsibility here. And I think this pandemic has exposed that to a level that people are more talking about equity and more talking about how to address those issues. And we've seen a growth of diversity, equity, and inclusion. And I so appreciate that.
Thank you. And so we do have a few more minutes for people who could stay on. And this is just a really great question. I do want to add that a recording will be available to attendees on YouTube. A link will be posted to the Facebook pages of ASALH and the League of Women Voters of Orange County. Want to get to this question. Are there any work-related health issues impacting the Black community that should be addressed? When we think about our history here.
Yeah, I just want to throw in some ideas about, we are seeing more people who have anger, and it comes out in the workplace. And it's because people may not understand that they have issues and they're not getting help. But I would believe that more people are being referred for mental health services because of behaviors that are seen in the workplace. And so we typically have to screen, and I like Dr. Candace's, comments about that. We have to screen for anxiety and depression almost routinely. We have to ask those questions, whether it is a structured format, or whether we're just talking about how people are handling stress. And I do want to say the level of stress for all of us has gone up, and we just have to be aware of why. And it's because of everything going on with the pandemic and in the world. We just have to be aware of how we're handling stress, and to understand that we all deal with it, stress, in many different ways. We just don't want it to get to the point where it just takes over our lives and we cannot function.
I would say that, and I agree with you, Mary Jo. In the workplace, there's many stressors. When those pressures and demands are greater than your resources or the time that you have to complete those tasks, it can be overwhelming. It really can. And the expectation is that you will complete that task before your shift is over. So it can be very overwhelming. So yes, I think there are some work-related things that cause diseases and illnesses among people. But there's just many things that we can do. I think I do believe it's societal. I agree with you, Dr. Jones, that it is societal. But individually, we have to learn what our limits are, ask for help, learn how to meditate and pray. If there's a chaplain in the building or at the hospital, wherever you work, or someone who's a spiritual advisor who can give you that strength or redirect you, because sometimes people have been even tempered and calm, but we've seen a difference in their behavior now with this COVID. Because the stressors are ongoing. And so, yes, in the workplace, we have to realize when we're stressed and then ask for help. And if necessary, there's EAP. I think Mary Jo mentioned that. Employee assistance programs, we cannot, that's available resources that we may need in order to help balance the things that we cannot change that are going to happen in the workplace.
Wonderful. Thank you all so much. Just eyeing the chat box to see if there are any more final questions, and you can always continue your conversation in any way you'd like. Somebody commented about the need to care for each other, and that's true. There is a relationship between collective pain, collective healing, and individual pain and healing. And so this has just been such a phenomenal question. At this time, I'm just eyeing the run of show to see where we're headed next. So it looks like, yes.
Can I add to that while you're looking? Can I add to that last comment? I'm in a group of Black doctors group on Facebook. And if I could tell you about work-related stuff for doctors, a lot of what they're sharing is the stress of this pandemic, losing their patients, all of the things that all the ladies talked about, but also a layer of discrimination, racism, and bias in the workplace. And I think a lot of it's inflamed by the politics that's going on. So that is pervading workplaces right now. And minority people already kind of felt that and knew that was there, have these experiences of discrimination or racism in our daily lives, but added on to political stuff, added on to the pandemic, losing your patients, or, having a COVID patient dying, but they're not accepting the treatment or the medication, or they want ivermectin and they think you're of this, it's just so interconnected right now. And so they're really experiencing that and needing support around that. And these are Black women physicians. So I imagine at every level of the hospital, these things are going on with this interconnection of the health, the politics, the interpersonal relationships that may have race at the core and beliefs. And so a lot of that is very, very, very stressful. So I would add that.
Yeah, that sounds quite stressful. And, we want to thank a lot of people within the media industry, within film and television, who also tell these stories in a format that help us all understand. I could think of a few shows. And really, a lot of thanks to Elizabeth Thompson for providing that history, because we could see the impact of Black physicians on our Central Florida community and much larger, and just acknowledge that to a great extent, Black people had their own institutions and really, created these spaces because we had to, we had to, but now things are a little bit different. So thank you so much, Dr. Candace, and thank you everyone, Dr. Sankey, Mary Jo. I'm gonna pass the conversation now back to ASALH's co-host, the League of Women Voters of Orange County. Thank you for all attending.
Hi, everyone. And I want to add my thanks. Renata, terrific job. Dr. Candace, Dr. Sankey, Mary Jo, just so much great conversation and food for thought. I know everyone appreciates it. And Elizabeth, you did a great job sort of setting the stage with the historical perspective. It all just meshed together beautifully. And I think all of our attendees got a lot out of the discussion. I have a screen I want to share with some calls to action. So just bear with me for a second here. The League, here we go, share. The League of Women Voters Florida supports the following opportunities: women's reproductive rights, privacy, and the availability of services, expanding access to healthcare, including support for Medicaid expansion, reducing, oops, sorry about that. Sometimes my screen is so sensitive. Reducing disparities in health outcomes, particularly among minority populations, supporting our medical community and local decision makers in following the CDC guidelines to mitigate and prevent the effects and the spread of COVID. Also to check, also reminders, check your voter registration status, update and change your name, your address, your party affiliation, any of the above by going to registertovoteflorida.gov. Our votes really can help in accomplishing all of these things that are so important. Knowing your registration and election deadlines, know your registration and election deadlines by checking your county supervisor of election website. And for candidate and local election information, visit the League's nationally recognized voter information website, vote411.org. And last, be a multiplier, a vote multiplier. Tell 3 friends to register and to vote. I also want to take a minute to thank our DEIA committee with shout outs particularly to Saudi Ellis, Marilyn Baldwin, and Virginia Meany. They assembled this exceptional panel and worked with them to develop today's content. And we all thank you for an excellent program. You really did, you knocked it out of the park, as they say. And then I guess last I have, oh, well, 2 things. If you are watching this and you are not a member of the League of Women Voters in Orange County, please go to LWVOC.org, and membership is very easy, but your membership would be appreciated and make a difference. And then for our members, I want to remind you to register for the League's planning meeting, annual planning meeting, which is being held on February 26th in person. It is a cost of $15 and refreshments will be served, and you can register on our website, of course. And with that, I thank everyone for attending. And yes, the recording will be available on YouTube. Usually it takes about 24 hours to get that up. Okay, thanks everyone.